Welcome back, everyone. Thank you so much for joining us again. Next, we are moving to our wonderful panel discussion today. And first, please allow me to welcome the moderator for the panel discussion, Ms. Kai-Jane Malone. Welcome. And Ms. Malone is a community strategist for Aetna Medicaid Community Cares team. She's a native Metro Detroiter who graduated from Wayne State University in May 2019 as an NIH Rebuild Detroit Scholar with a bachelor in public health and minor in health psychology. She is passionate and motivated public health professional with background in STI, HIV prevention and education. She educated hundreds of Detroit community members on their health options at the Detroit Public Health STD Clinic. She is now continuing to serve the Metro Detroit area as a community strategist for Aetna Medicaid. In this role, she continues to contribute her knowledge and expertise to community engagement within a local community-oriented team focused on social determinants of health and health equity. Ms. Malone, welcome.
Thank you. Good morning, everyone. I'm really pleased to be here today. Really excited to be moderating the panel with these fantastic individuals. And so we're going to run right into their introductions. So I believe we're going to go in alphabetical order for our panelists. So Danielle, do you mind beginning your introduction, and then we'll go on in alphabetical order?
Sure. Need to go first, but
I know.
Hi, everyone. My name is Danielle Atkinson. I'm the National Founding Director for Mothering Justice. I also sit on the Board of Governors. I think I'm the most freshman on the Wayne State Board of Governors. And I'm happy to be here. Is there anything else, or was that it? Great, thanks.
We can go on to the next one. I believe Dr. Hastert, you're next.
Hi, everyone. I'm Theresa Hastert. I am an associate professor in the Department of Oncology at Wayne State. Most of my work focuses on socioeconomic factors and health outcomes. I focus on cancer survivorship, financial outcomes after cancer, and I'm increasingly incorporating community engaged research in my work.
Wonderful. Thank you, Dr. Hastert. Shannon.
Good afternoon, everybody. Shannon Lijewski. I am a Michigan native as well, and have spent the last 22 years as a community health worker and helping to advance social determinants of health efforts.
Thank you. And I believe.
Just a little bit about us. So we are a Michigan-based organization that focuses on community supports and health equity.
Thank you. I believe, David, you're next. Oh, you're still muted. No worries, happens to us all.
Sorry about that. It's always one, right? Good afternoon, everyone. My name's David Underwood, or it's still good morning, I should say. David Underwood of Detroit Community Care Network. We're a faith-based organization that is made up of member churches. We have a trained cohort of volunteers who have been trained in a curriculum called Transition to Success, which is a standard of care on how we treat those or how we interact with those who are socially deprived. We also have 13 newly state certified community health workers through our faith-based organization, and we deal directly with the social determinants of health needs of our community. And I'm glad to be here and part of this auspicious body. Thank you.
Wonderful. Thank you, David. And I believe, Sam, you're last.
Hello, everybody. Glad to be here. Samuele Zilioli. I'm an associate professor in the Department of Psychology in the Department of Family Medicine here at Wayne State University. I'm also the director of the Biopsychosocial Health Lab. You can see here some pictures of the team and the things that we do. Primarily, we do research among people and participants from Detroit. Our work revolves around understanding how socioeconomic status factors such as income and education get under the skin to impact health. This is just a slide briefly showing the focus of our research. We're interested in how factors, again, like income and education affect health. We're interested in the mediators of these relationship, meaning the mechanisms through which SES influences health, but we're also interested in moderators, that is, factors that might attenuate the deleterious effects that low socioeconomic status backgrounds can have on health, as well as how SES intersects with things such as race or neighborhood adversity in influencing health. And again, glad to be here. Looking forward to this panel discussion.
Wonderful. Thank you to all the panelists. I really appreciate you taking the moment to introduce yourselves to the space. So I just wanted to thank everyone once again for being here today. I broke down the following questions into three sort of groupings. And so I want to first start off our panel with these first set of questions, which are going to center around sort of what's the problem today? What are we seeing right now in the community? So the first question I'm going to pose mainly towards Sam, Shannon, David, and Danielle is, in your experience, what are some of the most pressing needs for Detroit residents as it relates to employment and income? And you all can take it as you would like. We can go in alphabetical order too, if that works.
Or reverse alphabetical order. But I will go first. I will go first. So Mothering Justice, I didn't really elaborate on the organization, but we are an organization working on the financial stability needs of mothers in our community and leadership development for mothers of color. We're a community-based organization. Our tactics include advocacy, policy advocacy, community organizing, and the start of that are community conversations and one-on-ones with moms. So I really love to be surrounded by researchers, but what I'm talking about is the experience of myself and organizers. We asked the question, what is impacting your financial stability? What pocketbook issues are the most important to you? And that was the question that led to what we call the Mama's Agenda. And those are the policy priorities that we work on. And number one at the top of the list is childcare. We have to look at childcare as a social good. We have to look at it similarly to public education, K through 12, that a community, a family, a society cannot thrive if that system is not intact and affordable and accessible and is accounting for all of the people in the ecosystem, right? So the person who's providing it, the people that need the service, and then the community in which it sits. So childcare, huge. Workplace policies like paid leave, paid family medical leave, wages. It sounds so incredibly basic, but if you're really listening to conversations that our politicians and are making, there's not a lot of talk about a good job. There's talk about jobs and how many jobs we have. Guess what? My mother had 3 jobs most of my life. And unfortunately, only one of them was a kind of good job. So we have to really be thinking about the quality that our jobs have, and then also what we as community members can do to mandate that jobs be good jobs, so people can not only earn the money they need to support their family, but have the time to take care of that family.
Thank you. That was a really beautiful response. And childcare is definitely something I don't feel like it's lumped into what really needs to happen today, as well as quality of employment. Those are really great points that you brought up. Thank you. Anybody else from the panel want to chime in on this first question here? I can pose it again if we need to.
Yeah, I just want to say that was, thank you, Danielle, for that answer. The only thing I might want to add since we just had a keynote speaker who did an amazing job contextualizing Flint, I just maybe want to do the same for Detroit. And we know that there's some historical reasons behind the economic challenges that Detroit is facing and has faced for decades, and those are routed in the decline in the manufacturing jobs, the population loss, and as a result, the high poverty rates. I have some stats from 2020 indicating that the poverty rate in Detroit is around 30% higher than the national average. The median household income is $31,000, and that is significantly lower than the national average, standing right now at $69,000, and the poverty rate being 34%. So very comparable to Flint, compared to the national average of 10.5%. And obviously these factors contribute to high rates of unemployment and income inequality in the cities, in the city, and these challenges require investment, as Danielle was saying, in not just more jobs, but things that are related to high quality jobs, like job training, education, addressing barriers to unemployment, such as childcare. And I want to add another one that might affect people living in the Metro Detroit area, like transportation. And so this is a way that we can really address these financial challenges and improve the quality of health and life quality.
Certainly. Thank you, Sam. And Shannon, I saw that you also hopped off mute, and David as well. Feel free to chime in on this first question if you'd like.
Well,
I'll defer to David.
Okay, I guess I would just add a few things. I agree with everything that both Danielle and Zilioli have said. In regards to the child care, I'm a strong advocate, especially as we're talking about poverty, which means that folks meet the criteria for what we consider the Head Start program. I'm a big proponent of Head Start. I believe that, and Head Start now is 0 to 5. So we're talking someone who's pregnant now being able to be in the Head Start program even prior to the baby being born. And they have all types of wraparound services that are being opposed with those families and making sure that their needs are met at the onset. But in lieu of that, I believe that all parents should make sure that they have their kids in these programs to give them the best start that allows them to have the freedom. I see so many single moms that are out in the community, and when we're at these events, whether they're health fairs or others, that they're dragging these babies along with them. And it's like during the part of the day when these babies should be in a Head Start program. And I'm wondering, do we really push for our parents to get their kids in the early Head Starts and that 0 to 5 age, which would really free them up to have some time for themselves to be able to develop their skill sets. And I think part of what we need to make sure that we're doing is having some financial literacy training. We keep talking about jobs and education. That's a good thing. But once people get a job in education and they've never had the ability to have income that they had to even worry about planning and budgeting, what are they going to do with those resources when they even have resources, whether they're meager resources or many resources? How are they managing those funds and those resources to best live the type of life that will give them a strong foundation to support not only themselves, but their family? And I think financial literacy is going to be important, because whatever little you have, I can give you a better job and give you more money. But if you don't know how to take care of your financial responsibilities because you've never had that, right? You can miss the boats. But if you've got meager resources and you're trained on how to budget properly, to take care of all your responsibilities, I think we can see a lot of people who can maybe not have what we would call high-level income still succeed in life and give their families a basis, a sound foundation from which they can grow. And I think, you know, financial literacy is also something we need to be looking at. You're muted.
Whoops. My turn now, right? So in lieu of just to conserve time, we still have a lot of questions to get through. So Shannon, I'm going to pose this next question to you to answer first. Could you take some time to discuss the unique employment landscape in Detroit, and maybe even Metro Detroit, and its impact on income stability, health equity, and making sure to focus that answer on how it affects historically marginalized populations? Could you bring some perspective to that?
Thank you. I've had the amazing opportunity to work with a group of individuals supporting building the career pipeline for healthcare providers in the Detroit area, specifically making sure that we have our community health workers that have prevailing careers, increased wages. As we know, income influences our health outcome status as well. And so those are some of the efforts that we are seeing as increased in community members receiving certificate-based skilled trade and that advancement into those career pipelines that can help to provide economic mobility.
Thank you, Shannon. Are there any other individuals on the panel? I can go on to the next question. I think actually
I can chime in quickly here if that works. One of the other things about like the employment landscape in Detroit is that we have sort of our employment sectors, we end up having a population that is overrepresented in sort of, so like things like transportation, service sectors, those end up having lower incomes than some more professional managerial types of jobs. In Detroit, especially, our non-white population ends up overrepresented in these sectors that are service-oriented, transportation-oriented. It means that as a whole, they end up with lower incomes and sort of worse access to sometimes employer-sponsored benefits, things like really high-quality health insurance, paid leave, all of those kinds of things. So even it goes back to what Danielle was saying at the beginning, like we need jobs, but we also need good jobs. We need jobs that have enough income, enough benefits, enough sort of bandwidth so people can access healthcare services and have enough money to be able to manage themselves, their lives, their families.
Agreed. I think that's a fantastic point. And I actually want to, and I'm looking at the chat too, I hear a lot of people agreeing at the point that David raised with financial literacy and that exact point too. So going into the next question, what are some key social determinants of health that interact with income and employment? I can definitely see financial literacy kind of lying underneath that economic sphere, right? So what other ways are social determinants of health intersecting with income and employment, and how are these influencing health disparities? And I can open that up to the entire panel to answer.
Well, three things that come to mind that probably everybody is thinking about is access to education, housing, and healthcare. So if you have limited access to quality education, can hinder employment opportunities and perpetuate those income disparities we've been talking about. And I use education very broadly, and financial literacy is a component of that. Lack of affordable housing can force residents to living in unstable living conditions, and that obviously can affect their well-being, access to other resources, and finally, limited access to healthcare services. So these are three that comes to mind. As part of my research, I'm also interested in other social determinants of health that sometimes people don't necessarily talk too much about. I'm a psychologist by training, and so I'm interested in factors related to psychological stress being something that we know it's relevant, but sometimes we can't really quantify the impact of stress. It's not an easy job, but that's what we're trying to do, for example, in my own lab, and other things that are related to that, such as that comes after, almost like a cascade effect, such as health behaviors. This is obviously all interconnected. It's obviously a very complicated set of interconnections, but that's what we're trying to do in my lab. to also understand if there's something that we can intervene upon. We can intervene upon on those distal factors, better jobs, more literacy when it comes to financial decisions, but we can also intervene on things that have these more distal factor have an effect on, such as health behaviors that broadly are under this umbrella of social determinants of health.
Yeah, I really love that. Oh, sorry. I really love that because I think a while ago I Googled sociological or psychological social determinants of health, right? You know, we know that people need to have access to hope, security, connection, as well as the physical things that really determine people's success. And I think this is what's really an easy exercise for someone who's not a researcher to do is just think about what got you to this moment in your life, right? So you were able to go, you had a decent K through 12 education, okay, not a given for most people. You had access to higher education. What went into that? That meant somebody in your life made you feel that that was something you could do, and then it was physically made accessible to you. You have a car. You have a car that gets you to a reliable car that gets you to your employment. Your employment is somewhat secure. You feel like you can stay there. It also provides for other means, as you know, Theresa was talking about, your health care, your benefits, all of those things are there for you. You have a family support system, or you have friends, or you don't have these things, right? But thinking about all of these things and how difficult or how easy it is for you really puts into a very clear perspective and picture of how hard it can be for somebody to be okay.
Yeah, and to add to that, in addition, I just want to apologize to everyone. My computer internet connection is acting up right now, so I'm on my phone and it's a little wonky. So I apologize if I'm a little not in the frame I would like to be. But to go back even beyond the psychological social determinants of health, you think about what are the economic ones. So like economic stability, like Danielle said, access to education, healthcare access, neighborhood and built environment factors, social and community context factors. And so if you're looking at Detroit, we have such substantial racial residential segregation in Detroit that we have populated, like the 25% of Wayne County identifies as Black or African American. It's almost 80% in the city of Detroit. And that also has implications for substantial economic segregation, where about half of Detroit's census tracts are persistent poverty areas. So where at least 20% of the residents have been in poverty going back 30 years or more. And that has implications for social and economic disinvestment. It has implications for employment opportunities, access to social services, access to like neighborhood connections. And all of those things feed on each other to the point where even if individuals have good jobs and good incomes, if they live in some of these more declining or deprived areas, that impacts their health and their opportunity beyond their own individual socioeconomic status. So it's both things. It's getting access for individuals to be able to have the resources that they need, but also to be able to be in communities where they have access to opportunities to be able to pursue additional education, employment, stability, and psychological well-being for themselves and for their families.
I would add that as we sit here as panelists and we have these discussions and we're on the outside looking in and we're answering very difficult questions or giving our opinions, if you will, about very difficult issues in our community. At the end of the day, those individuals who are experiencing the lack of, as we're speaking about in these neighborhoods and the communities in the city of Detroit, and even some of our other surrounding cities, it really gets down to what type of support individuals have. If they're left to their own fruition to try to pull themselves up by the bootstrap, as we used to say, make the right decisions, go to school and get a good education, all that's fine and dandy for you to tell me that. But if every day I'm trying to figure out where I'm going to lay my head or how am I going to take care of my brother and sister or younger brother and sister, because maybe I'm the the adult of the family because my parent is drug abuser or whatever. I mean, there's a lot of stress to be able to try to figure out how to find a good job, get the good education and all that. Really, it's about supporting the community through, and I look at it from our perspective at Detroit Community Care Network, being a faith-based organization. We train volunteers at our churches to be advocates and champions for those less fortunate in our community. We have what we call a process where we actually map dreams. In essence, to really get to the crux of someone's challenges and to help them maybe get to the level that they hope to aspire to get to and live the type of life that they live, they're going to need someone that's going to be there, that's going to help them champion, be there to help support their needs at times when they don't have the support, to be able to help them craft that roadmap to success as to what their dream is. We ask the question, what's your dream? But before we can even get to that question, I've got to make sure that the person feels comfortable where they live, that they've got food to eat. If all those life stressors are daily things that they're dealing with, they're not going to be able to begin to dream about what can I be for my future and for the future of my kids. So our work is really to help solidify a foundation for a family to the point where they can begin to dream again. And then that's the real question that we ask, what is your dream? And then we want to help map that out and give some practical steps of things that they need to do. If it's to be a nurse, to be a business owner, okay, what do I need to do to get there? And then we look to map it out and then support them along the way with the resources that are available through all the different stakeholders and community partners that are out here who really want to see our community succeed. We just got to help activate their ability to deliver what they have and then connect them with the people that actually need their services or resources.
Wonderful. Those are such fantastic responses. I really loved the depth of everyone's perspectives too on that one. As a social determinants of health strategist, I understand that this work intersects with so many issues that individuals are facing on a day-to-day basis. And while it might be easy for some of us to tackle some of those opportunities that we might need to have the best success in our lives, it's not always the case for everyone. So it's really important to highlight those issues and those disparities. So I want to go into our last question for this set of questions here. So how do income disparities impact access to healthcare services and health outcomes within communities? And what strategies can be employed to address these inequities? So Shannon, I don't know if you want to take that one on first and we can move on.
Yeah, I'm happy to start off. You know, as we look at just income disparities in general, we've talked about how they have a direct impact on healthcare services, access to education, access to housing and nutritious food and childcare. There's a lot that income leads into. The thing that I really heard in the previous discussion that I think we need to elevate too is the sense of hope, right? The sense of self-efficacy and that ability to struggle well and hopefully thrive through all of these adversities. And more importantly, you know, those factors that are often not talked about around health literacy and financial literacy. There was a call out in the chat around, you know, even people with income might not have these skills. And those are things that also can be co-contributing factors to really make the situation either worse or better. That was one thing that just, you know, really popped out to me as we've been discussing this.
Wonderful. Thank you, Shannon.
You're welcome.
So
can I pop in and just also going back to employment, like if we're talking about income disparities and being able to access healthcare services and health outcomes, we have a largely employment-focused model of health insurance. And so there are big disparities there in how good is your insurance? How comprehensive is it? Are you able to cover the things you need and the places you need? Can you get to the providers you need to get to? So a lot of that, like that, it's not just the income, it's also what comes with that income. In a lot of cases, those are other benefits that help you do that. And so public benefits like Medicaid and Medicare can kind of blunt those effects a little bit. So Medicaid for people who have severely limited financial resources, that can help. Medicare for those 65 and older. But when we're talking about incomes, it's not just the income, it's also the other benefits that come with it.
a good point, Theresa. And just continue to meet people where they're at, having these partnerships that strengthen the system, having the work that David's organizations are doing, and others that are on this call. We're all collectively working together for the common impact. And we have to sometimes think innovatively, and make sure that we are not overlooking the obvious. Sometimes there are some very small solutions that are very impactful and have great credibility that we need to scale. And then listen. I would say listen to the resident voice, and then continue to build the, I'll always be an advocate for our CHW workforce, our lived experience, our peer-to-peer, the work that Danielle's doing, just really helping to work alongside the community members. Over to you, David.
Yeah, I'm kind of excited. Just most recently, I think on the 8th of this April 8th, this past week, the Michigan Department of Health and Human Services put out their they selected the successful candidates or successful health plans who all applied for the state Medicaid to be a provider for state Medicaid residents here in the state of Michigan. And Kajana Edna was one of the, as well as all the others that we're very familiar with, Priority Health, Blue Cross Complete, all the others, Molina, Meridian, pretty much all of those who were there last year. But what I'm excited about is that they have been mandated that they deal directly with the social determinants of health of their members to help their members with needs that they probably never been mandated to do before. And to me, that's an opportunity, because I don't think individuals really understand how to utilize the benefits of their health plans extremely, like they should. There are opportunities now to have your needs met through your health plans, and to make sure that you can hold them accountable to making sure that they get you what you need. And so I think we need to lift that up in a positive message, in a positive way. I think a lot of times people used to be a little concerned about, hey, when you asked for their insurance card, or you asked them for, like, I'm going to provide this service, I need your insurance. And people were a little reluctant to pull out their card or to share that kind of. I think it's now a badge of honor. I want to milk every benefit that is possible out of the health plans. I want to milk it. And so I think we need to champion that and make that a positive, something positive within our community, that, those who are on Medicaid, you have benefits. Let's take advantage of those benefits to get your needs met, to help you get the foundational support that you need so that you can be healthy and well, and your family can be healthy and well. So I'm looking forward to where our state is going, where we're going with our community health workers, being able to support the social determinants needs of our community members. And I think if we all work together and from a positive standpoint, uplift benefits that are available to all of our Medicaid, all those in poverty in our community, that we might be able to help make a difference in a meaningful way, and see some impact that we can really measure and tout, if you will, amongst other communities across this country. So.
Well, thank you, David. I appreciate the plug. Yes, we did win the bid. But yes, as a social determinants of health community strategist, a lot of the points we were just mentioning, yes, they apply. Part of my job is to make sure that my community health workers have the education, have the resources at their own disposal, so that they can support the members, they can support the communities in which they live in. So yes, if you do know of individuals, or maybe have clients that do have Medicaid, please let them know that there are tons of opportunities that they can have at their disposal if they reach out to their advocates, to their health workers, what so have you. They have opportunities, just an abundance that come their way. And one other quick point I wanted to also throw out there. There's this resurgence, new resurgence of Z codes, and that language surrounding Z codes also includes a component of employment and income restrictions. Are you having difficulties making ends meet? Are you living paycheck to paycheck? So making sure that you're also aware of providers that are actually documenting those Z codes, which can be reported back to your health plans, that you are reporting the fact that you are having these income disparities, what so have you. That can also be shown on the health plan side. Like, we can see that in our members and the fact that they're struggling. And so that informs our work, and that helps supports people like me to be able to do the work that we're doing. So just wanted to throw that quick point out there. And thank you to our panelists for that first set of questions. We're going to go into the second set here on what are we doing right now to actively address the solution. So I feel like Shannon and David, you both have spoken a little bit about your programs. And Danielle, I would love to hear your perspective too on some of the programming you're also doing. But can you give us some examples of activities and programs that have been successful in boosting clients' income or employment, and maybe some just other perspectives that you have on that? And I can turn it over to you guys. Answer.
Well, one of the things
okay,
that
go
I'm
ahead,
sorry.
David.
Go ahead, Danielle.
No problem. Thank you. We were good minds think alike. It's funny, when I read this question before, which shout out to me for prepping. I was thinking, Mothering Justice, we're not a service-based organization, but it's a distinction that I don't think really matters in this context, especially when we're talking about all hands on deck for solving a problem. And we're an advocacy organization, and I think it is a service. And what we bring to the table is, one, continuously pointing out that the system was not made for all of us, right? All of these systems of employment and benefits really relied on a narrative of one white man in a family going to work with who's a heterosexual married to a white woman, and with unpaid labor, mostly Black and brown women taking care of their children. That is the premise for a lot of the policies in this country. And when we understand that and continue to point that out, then we're closer to the solution, right? So that is something that we continuously do. It's what we're talking about is human design. And when we center the people who are most of the times left out in the design of the programs and the structures, that is when we come to a solution that will fit everyone. So when we're centering women of color, parents, we are raising all boats. We are creating a system that is better. So that's what Mothering Justice, is bringing to this table.
Before you chime in, David, I just want to elevate that, Danielle. Our slogan nationally for CHWs is nothing about us without us, because we're so culturally diverse, represent over 100 different languages and over 1,000 cultures, and just really knowing that we have to be co-designing these systems together and alongside community members.
Could you read the question again, John? I just want to make sure I'm...
Certainly. So could you give us an example of an activity and or program that has been successful in boosting clients' income or employment? I know you raised the Mapping Out Your Dreams program. So I don't know, maybe if you want to expand on an example of a particular moment of success.
Well, I'll start with our work, right? Because really the standard of, if you will, transition to success is a model of standard of care on how you treat those who may be lacking resources. What I found is that the folks that I have been training, many of the folks that have been trained at my church, are actually, if you were to put them in a bucket, they'd be a client, right? And so therefore, their skill set was improved just by simply becoming a volunteer, if you will, and going through a program training, a 3-day training. And to this day, I'll give an example of one. I won't mention the name, but one of my clients who started with us was one who was considered to be a client, if you will. They were in poverty. They were struggling. They took our transition to success training. They became really the go-to person in their neighborhood and community because they activated this training, and it kind of excited them about the ability to be a servant and to be able to serve those who are peers of them. And as time progressed, that individual became probably one of our strongest resourced individuals because they had the lived experience. So they struggled with, oh, I got to figure out how to fix the leaky roof in my house. I got to figure out how to buy the food. I got to figure out how to do all these things. And they became a strong resource for all of our other coaches and folks who were trained, right? To this day, that individual now has been hired, if you will, within the transition to success workforce, so to speak. And now they are part of the national training team, if you will, in transition to success. So just getting involved, if you will, in this work of serving others and helping others as they began to touch others and began to interact with other stakeholders and TTS, the Transition to Success team, they found employment, right? Because of their skill set and their ability to navigate. They became one of our strongest Transition to Success coaches, if you will, and continued to champion that today. After that was probably in 2017 that individual took the training, and today still gainfully employed. So just one story. A lot of the folks that are taking the TTS training, I have retired individuals. I have an 80-year-old retired senior who is probably now one of my better community health workers, who has now the state of Michigan Department of Health and Human Services has tagged their church as one of the wellness hubs. And now they're being activated to be the wellness hub, and they're getting stipends and their income. You know, they don't even want to make that much money. That was the surprising thing. You know, we had stipends built into the work this past year that we were doing. They said, oh, no, I can't take that much money. I'll take this much money. And then they added another volunteer because it was 3 seniors, and they wanted to limit their income. But the income that they're making now, one of them just came off the cruise and so forth. So, I mean, people don't have to have high income. They just need what they need to live the life that they want to live. Everybody doesn't have to make 6 figures to be happy, right? Somebody can make $40,000 and they can live just as comfortable and be as happy as someone making $150,000. So I would not always think of income in dollar amounts as the measurement of success, but more so, are you able to meet the needs that you have, and are you happy and healthy? That to me is a measure of success.
Most certainly. And that is such a beautiful example. I'm really happy to hear that they were able to scale up their abilities to be able to become such a leader in the Transition to Success program. So that is beautiful to hear. So I'm going to go on to our last question for this set. We do have a little Q&A portion at the end that we'd like to have here. So if you want to drop some of your questions in the chat while we finish up the rest of the panel questions here, that would be fantastic. So Dr. Hastert, this question is to you specifically. How does financial toxicity, particularly in the context of cancer care, impact Detroit residents? Now, that's part 1. This is a loaded question. So part 2, what strategies can healthcare providers and community organizations implement to alleviate the burden of medical expenses and financial stress for cancer patients and their families in the city? So no pressure.
Yeah, there's a lot there. So for people who don't work in cancer, you may anecdotally understand that cancer is a very expensive disease to treat. Chemotherapy is expensive. Radiation can require people to go day after day for several weeks at a time. Surgery is not cheap. So cancer is an expensive thing to treat in general. Cancer also can lead to things like people need to take time off of work, which can then decrease income for them and their families. So we did a study a few years ago of Black and white cancer patients in Detroit. And among that population, close to half reported some sort of financial hardship. So using assets, decrease in income, borrowing from friends or family, cancer-related debt. And it was about 18% reported that because of financial issues, they didn't get all of the care that they needed. For For the most part, people are able to access care. It's just a matter of then what happens to their finances as a result. Do they end up in lasting debt? And the only difference between Black and white cancer patients was in terms of debt. It was medical debt was higher in Black patients than white patients. A lot of this gets back to what kind of insurance do people have? How comprehensive is it? Are people able to meet their out-of-pocket costs, their co-pays associated with accessing this kind of care? And in terms of what providers and community members can be doing, so when talking to providers, they're very unanimous in terms of the financial concerns that patients bring. It is insurance, out-of-pocket costs, issues with work, and transportation, being able to get into cancer treatment. In a lot of cases, the provider themselves, the oncologist, may not be the person to address that with them. Oncologists can do things like pick a similarly efficacious treatment that might have a lower out-of-pocket cost based on that patient's insurance. They may be able to schedule treatment so people around people's work, so they don't have to miss work. But in a lot of cases, you're going to need like a social worker or a navigator, someone who can connect with the kinds of resources people need. The other thing is cancer is so specific. Different people have, some people need employment-related things, some people need copay assistance. So we have been working the last few years with members of Cancer Action Councils through Carmena's Cancer Institute. They identified financial hardship as a priority area for intervention and for research. And so based on that, we're developing a website that has sort of common issues around like, what are the financial costs of cancer? What are the basics of health insurance? How do you use it? How can you find resources to help you pay for things out of pocket? It's in beta right now. It'll be hopefully live next month. I'd love to share it with everyone when it comes in. But also, I mean, David, maybe you and I should talk about financial planning. Like, I'm really interested in financial planning for people before a health shock. So are they maximizing their health insurance coverage before a cancer diagnosis, before a heart attack, before they need something that's going to be really expensive and they realize, oh no, I was underinsured. So yeah, there's no one way to do it, but there are a lot of different ways to kind of approach it to help people be able to access the care they need and not go broke while getting it.
Wonderful. Thank you, Dr. Hastert. I think you tackled that very well.
Thank you.
So we're wrapping up some of our panel questions here. And so one of the final ones here, I'm going to post to all of our panelists here. We're running a little low on time, so just try to keep it to around a minute for your responses. But we all realize that the work that we're doing is impacting the space in different ways. We're changing the landscape as it is. So we need to also take that moment to realize, what are our next steps, right? Where do we go from here? So for all of the panelists here, what are some key opportunities for collaboration with other community partners that you see that maybe you're not engaging in right now, or maybe you would like to continue to push forward? So I pose that to all of our panelists.
Yeah, and Theresa, I really appreciate your message in the chat, because I want to touch base with you as well. Mothering Justice, because of all of these conversations, having a conversation with one of the Michigan Women's Commissioners, who is head of radiology at Henry Ford, and our community organizers and people with children with chronic illnesses and cancer survivors, we approached a funder and we said, we want to give direct cash payments to people who have a recent cancer diagnosis, who are also caring for children. We also want to incorporate social workers in that. And we want to incorporate employers who are trying to make space for caregiver employees. And we have to be thinking about all of those intersections when we're thinking about collaborations, because we don't live single issue lives. We don't, nor does anyone. And when we're thinking about addressing a problem, we have to be tackling it from all the different aspects of where people live. Also, again, I will always put a plug in for thinking about caregivers. It is in our brains, babies are cute. We are designed to just love them and want to do everything for them. And sometimes that focus directs us away from the people who are struggling to care for them and who are their best advocates when they have their basic needs met, and when they don't have their basic needs met in most instances as well. So when we are centering caregivers and the act of caregiving and the totality of that, then we naturally think about these connections.
Okay, we can move on to the next question then. Thank you, Danielle. So the final question that I'll pose to everyone, and I do want everyone to just chime in on what is your vision in terms of next steps for your particular programs, and where are you looking to go in the next year or so?
Well, I can start there because I'm in the middle of working that plan as we speak. I've just been blessed and fortunate enough to meet Dr. Philip Levy last year in 2023. And Dr. Levy believed in our work at our church and said that he would like to see it expanded. And so he funded the expansion of Detroit Community Care Network across 6 other churches. So now there's 7 currently. And I'm happy to announce that Haley has also partnered with Detroit Community Care Network to also bring her Faith Community Research Network the opportunity to also be trained in transition to success. But we're looking to continue to expand and build our capacity to serve through the faith-based model, if you will, finding churches that are planted in communities of need, and then actually activating volunteers to become certified in transition to success, and then furtherly going along to become state certified community health workers. Wayne State University and Dr. Nate McCautry and Cheryl Summers have been very, very helpful to me, and they've actually awarded all of the successful transition to success coaches a free scholarship to attend Wayne State University's Community Health Worker Academy, of which we have 13 currently, and we have 14 enrolled currently in community health worker training, and we have a class starting this coming Monday for transition to success. Making a plug for anyone who's interested and has some folks that might be interested in attending that training. I know it's late notice, but 15th, 16th, and 18th of next week, 3 days, we have a transition to success training. And from there, those individuals will have the opportunity to go forth and become state certified community health workers. So our work is really about building capacity right now to serve the wider audience of our community. And we have great partnerships with Wayne State University, different organizations within Wayne State. And we're excited to collaborate with all partners who see our work intersecting and combining in some way. I'm open to collaborate because that's how we get our work done. We're a collaborative care model, not an individual care model.
Yes, certainly. Thank you, David, for that response. And please, if anyone is interested, please reach out to David for that program. Shannon, I want to turn it over to you. What are your next steps?
Our vision and next steps really just include the same thing as we're hearing around the table: continued collaboration, partnership, and advocacy to promote policies that are going to promote this economic and health growth. Expansion of our community-based programs. I can't echo that enough. Our CHWs right now, this is our movement, not our moment. I have worked very hard for that and believe that it's going to be a key to our success and helping with the social and economic mobility of all residents of Detroit.
Wonderful. Thank you, Shannon. Sam, do you want to go next? No.
Me?
Yes. What are your next steps?
No, sorry, I was a little bit distracted by the chat, and I was trying to answer Dr. Thompson's question about.
So we're going to take a little time after everyone just gives their last next steps here, just to answer some questions in the chat.
Yeah, I think in terms of if the question is still about the key opportunities moving forward, I just want to present what some key opportunities can be from researchers like me. And this key opportunities really aligns with what Dr. Thompson was saying earlier when she presented the progress made through the checkup program or initiative, which is really to build this community-based participatory research. Involves community members at all stages of the research process, because only by engaging community partners as equal partners in research, we can ensure that our research is relevant, is culturally appropriate, and addresses the priority of the community. And so we can do that by through workshop, through training, to collaborative activities. I know those are big words. It needs to be manifest. They should be we should be maybe more concrete, but I don't think we have time now to do that. But again, the bottom line is that involve the community in the research that we do at all stages, including the early stages, in terms of hypothesis, driving hypothesis, research questions, priorities, in what needs to be addressed and how that things should be addressed or measured, and it's something that as a researcher I have a lot to learn about that, and I'm very grateful for the work that Dr. Thompson is doing, and I look forward to learning more about that.
Wonderful. Thank you, Sam. And I see that you did respond in the chat, so thank you for that. I'm going to turn over to Dr. Hastert. Do you have any next steps? And then Danielle, I'll wrap up with you.
Sure, yeah. So I mentioned that website. We are really trying to get that polished up and sent out so people can actually learn from some of the work we've been doing with our community stakeholders, to help give people information and access to resources to help pay for cancer care. But that's a bit of a Band-Aid, and on a larger level, I'm trying to work on research that can inform policy to help with anti-poverty programs. Like, how do we actually reduce poverty and get people access to more resources? And also on an individual level, I just read Poverty by America by Matthew Desmond, and that has me thinking about, just as a person, where am I putting my money? And so can I be supporting employers that pay living wages, supporting employers that have union shops and that provide comprehensive benefits to people? And like, how can I be better at supporting the kind of world that I want to see as a consumer, as well as a researcher and an interventionist?
Really quickly want to chime in there. I think that's a really good point. We are both consumers in this world. So I think that's an excellent point. Danielle, what are your next steps?
Yeah, so we have quite a few policies that we are working on and really hoping that we can see passed before the end of the year. So we have a Mom Notice bill, which it's really a good time to talk about that since it is Maternal Health Week this week. And so that's a series, package of bills that addresses inequity in the first year of a child's life and a mother's choices, a birthing person's choices, actually. Let me be clear. And then FLOC, which is family medical leave. The governor said that she was supportive of that in August, and we are really working to get that passed before the end of the year. In addition, let me just press click. We have a lobby day next month on the 7th, and would love for people to attend. It's open to everyone, where we'll be talking about the Mama's Agenda in Lansing. And then we have a BIPOC Alana Coalition, and this is an initiative that is really looking at 0 to 3 and the care that people are receiving, and whether or not we are addressing all of the needs and putting out a list of policy priorities. And so it is focused on either BIPOC Alana practitioners or people who are focusing on that community. And so you could email me, Danielle at motheringjustice.org, if you would like more information about either of those things.
Wonderful. Thank you so much, Danielle, David, Shannon, Dr. Hastert, and Sam. I really appreciated you all and your perspectives today. This is really great work that we're doing. It's impacting residents in Detroit. I know we're moving mountains and they're tough mountains to move, but we are doing the work. So thank you once again. And I can turn it over to Naya and the checkup team to continue the summit. Thank you all for attending. And one other quick point, please drop your emails and your information in the chat, panelists. People do want to connect with you and learn more about your work. So please just take a moment to type that in the chat. Thank you, and I can turn it over to Naya and team.